This is abdominal pain tutorial, semiology tutorial presented by the SchrDbb with reference a practical guide to history taking and clinical examination by Answar Kiasadu. So here you're going to visualize abdominal pain. So abdominal pain can originate from intra-abdominal structure, or it can be referred from extra-abdominal structure. Intra-abdominal structure can be gastrointestinal or non-gastrointestinal causes like the pancreas or the liver. And then we have it refers to or it can be referred from extra-abdominal sites such as the lower lobes pneumonia. Those are the cases that you have to know. And then it is divided into two. So it can be, so we said that the first division is intra-abdominal, extra-abdominal, and the second division is acute or chronic. Acute abdominal pain is less than 2 weeks. Chronic abdominal pain is more than 2 weeks. So we start with acute gastroenteritis. Acute gastroenteritis is the most common cause of acute abdominal pain. So when you say acute abdomen is less than 24 hours, but acute abdominal pain is less than 2 weeks. Hope you understanding. So acute gastroenteritis is the most common cause of acute abdominal pain in children with functional abdominal pain. So why functional abdominal pain is the most common cause of chronic abdominal pain. So acute gastroenteritis is the most common cause of acute abdominal pain, while functional abdominal pain is the most common cause of chronic abdominal pain. Now, acute appendicitis is the most common surgical cause of acute abdomen in pediatric population. Acute abdomen. And what is acute abdomen? Acute abdomen is a sudden onset. It's a abdominal pain of sudden onset that occur before the first 24 hours. In first 24 hours, requiring an immediate intervention, which is not necessarily surgery. That's the definition of acute abdomen. So now, what is abdominal pain? So what is the history of abdominal pain? So the issue of abdominal pain should take identification, age, sex, address. We have the chief complaint. The chief complaint is abdominal pain. History of presenting illnesses. We have the onset, the duration of pain. We have the location of pain. You can just use Socrates to use as normal pain, Socrates, or you can use this method. Location of the pain. It can be right upper quadrant, suggests for hepatitis, right lower lobe, suggests appendicitis and all that. We have the radiation. So we have the nature. Is it diffuse? Is it burning? Is it colic? Is it sharp? Is it dull? So we have is it also crampy? Colic abdominal pain is a crescendo, decrescendo type of pain. Sharp crescendo, decrescendo type of pain. So we have frequency. If it occur frequently or asks for the frequency and the duration of the episode, we have the timing of the pain. Timing of the pain, you have nighttime or daytime pain and all that. So we have so the cause and progression of the pain, constant or intermittent. You have the severity of the pain, aggravating or relieving factor, associated symptoms. So you have the change in bowel habit and all that. Now you have the past history. Does the patient have diabetes? You need to know that one. Acidosis, which is a complication of diabetes, can be acidosis, which is a complication of diabetic ketoacidosis, can result to abdominal pain. We have inflammatory bowel disease, can result to abdominal pain. So you have to look for past issue of peptic ulcer disease, past issue of irritable bowel syndrome, past issue of urolithiasis, past issue of celiac disease, migraine, hemolytic anemia. So you have to look for that. The medication, you have to look for chronic or recent use of medication, e.g. aspirin, non-steroidal anti-inflammatory drug, narcotic, which can result to abdominal pain. Developmental history, you have to find if the child has a developmental delay and all that. So we have family history. Chronic abdominal pain in a family may tell in other family members. You have irritable bowel syndrome or inflammatory bowel disease, peptic ulcer disease, celiac disease, family history, urolithiasis, gallstone. So you may have a family history of all the social Social, you have a recent foreign travel, you have alcohol, sexual activity, you have school and sexual activity mostly in per annum. So if the patient does an anal sex, because the chlamydia can go and cause erectile disorder. So we have school attendance and sports. So we have the next one is review of system. You should try to visualize it. So the review of system mostly rule in and rule out other diseases. Now, key points in abdominal pain. Radiation of the pain may provide a clue to the diagnosis. For example, pain of the pancreas radiate to the back. You need to know that one. I've already told you before that for you to radiate to the back, you must be a retroperitoneal organ. The pancreas is among the other retroperitoneal organ. An example of retroperitoneal organ is with the mnemonic Salzburger. S for suprarenal gland, A for abdominal aorta, D for the duodenum, B for the pancreas, A for the next A is Salzburger, U for the ureter, C for the colon, that's the ascending and the descending colon, K for the kidney, E for the esophagus, and R for the rectum. So all those are the retroperitoneal structures. So, and you need to know that one. They are telling you here that one. So refer radiation of the pain may provide a clue to the diagnosis. For example, pain of the pancreas radiates to the back, while pain of renal stones or uretero-pelvic junction obstruction usually radiates to the groin. Are you getting? So the pancreas pain radiates to the back, even the esophageal pain radiates to the back. All the structures which are retroperitoneal, are you getting? Even the kidney pain is at the flank, radiating to the loin, to the lumbar region. It's at the flank, radiating to the lumbar region. The ureter pain is at the loin, radiating to the groin. Are you getting? So those are the points that you have to know of the pain. So now the pain is so you have that. So the abdominal pain that is aggravated by defecation. So when you are defecating, abdominal pain aggravating, you think of a chronic irritable bowel disease. While pain that is relieved with defecation, it suggests a diagnosis of an irritable bowel disease. So it's a chronic inflammatory bowel disease. Why this is an irritable bowel syndrome. And also you need to know that one, every time that you have a pain that is relieved by defecation, you need to know that there is a congestion inside the large intestine. It can also be an acute gastroenteritis affecting an acute enterocolitis, colonitis, or colitis. Are you getting? So abdominal pain occurring at night time, relieving by meal, may suggest a peptic ulcer disease or a gastritis. Can start with the gastritis, just an inflammation, then go to peptic ulcer disease. Suprapubic or loin pain associated with dysuria, frequency, fever, anorexia, nausea, vomiting, mostly dysuria is a urinary tract infection. But when there is fever already in that, you think of an upper urinary tract infection. But when there is no fever, you think of a lower urinary tract infection. A common cause of abdominal pain in children. Now, we have abdominal pain, and usually every time you have a child with fever, are you getting? You should check for ear infection, and you should also check for when you have a fever that you don't really have a point of focus in unit, you should always check the ears, and you also check the urinary tract. So you must ask for a urinalysis for that particular patient and do otoscopy to visualize the ear to when you suspect any fever of or known without a particular point of focus. So abdominal pain with fresh bleeding per rectum. Abdominal pain with fresh bleeding per rectum may suggest colonic bleeding or massive upper gastrointestinal bleeding. A periumbilical pain that travel to the left lower quadrant and associated with anorexic nausea suggests an acute appendicitis. Abdominal pain and vomiting in a child with diabetes mellitus should raise the suspicion for diabetic ketoacidosis. So this is, we are free from here, we are finished with abdominal pain. We continue with vomiting. Thanks for kind of